Hi SIBO community, it's Dr. Narala Jacobi. You know me from the SIBO Doctor podcast and the courses I put out about SIBO and other digestive disorders, and maybe you are doing the biphasic diet right now. I'm here with Anne Kreiner, our naturopath and clinical nutritionist who works with me at the Biome Clinic here, and we thought it would be great to just release a few clips about things like fatigue on the biphasic diet, food sensitivities like sulfur and salicylates and those types of conditions that we frequently encounter as practitioners in clinic. And so we just want to do a few little videos and keep you informed. So today's topic is about energy levels, and it's great that we have Anne here to talk to us about this, because there is a lot to talk about when we talk about metabolism, but we'll keep it quite simple and give you some tips on how to raise your energy. So, Anne, how often we frequently see people with energy issues at the Biome Clinic, and particularly when people switch from their normal diet to a low carbohydrate diet like the biphasic diet. So tell us what's going on there.
Well, the interesting part about that is if you're used to eating one particular way and you move to something like the biphasic diet, you're using energy a little bit differently. What's important for us to remember is we're kind of this dual-fueled machine that we are. We use carbohydrates to turn them into glucose, and we use fats to turn them into ketones. And it's the way our body shifts that is determinant on the foods we eat and how well we break those foods down. So, fatigue can be a real problem if you've shifted to a diet that's maybe higher in protein, higher in fat than you might have been eating before. Or if we've changed the ratios of what you're eating, you may have been on a keto diet, or you may have been on, a high complex carbohydrate diet before. And it's your body shifting gears to be able to use the foods in a new way. It's also an issue for some people when they start the biphasic diet is that they accidentally get too few calories. I'm going to just use calories because kilojoules, calories, all measures of units of energy from food. But you can accidentally get your calorie intake too low, and that's going to make you feel tired. If you're not getting enough energy just to wake up and be who you are, things like a diet assessment to go, are you getting enough from the foods you eat? And we can make minor adjustments, stay within the biphasic parameter, and adequately meet your energy needs.
Okay, so that's a great point. So just to kind of summarize that point, or go back to the original issue of fatigue, when you first start to treat SIBO, not just with antimicrobials, but also with the diet. So sometimes fatigue can happen because of die-off, right? We see this a lot when people start using their antimicrobials, whether that's an antibiotic like rifaximin or all the various antimicrobials that we use as natural healthcare practitioners. And then what Anne is saying is when you start to switch your diet to reduce the carbohydrates so that we're not feeding the bacteria, our brain and our muscles and our whole body is meant to run on glucose, right? Which is basically the simplest building block of starch and carbohydrates.
That's right.
And when we start to reduce that, our body's not used to it, and we start to get more fatigued. And also, people often tell me that they just, after exercise, they just have no energy left, and that's because all the glycogen that's the stored form has been sort of used up, and then this switch to using fats for energy is a bit more difficult. What are some other issues about fatigue in terms of what we frequently see contributes to fatigue?
Well, really basic, dehydration. Very often, dehydration is more than just, do I drink enough water? Am I using my water well is more the question we should ask. So dehydration, the first symptom of dehydration is fatigue and brain fog. And there are some people who are trying to drink lots and lots of water, but if your electrolytes are out of balance, you're not going to use your water well. So that's that I'm thirsty, I'm drinking, but I still feel thirsty after I've had a good drink of water. Or I retain fluid, Or for some people, if you're not well hydrated, you'll find you'll drink a glass of water and you'll need to void your bladder like within minutes. So it's that fluid balance in the body and making sure that you're well hydrated, and you might need electrolytes while you're on the biphasic diet.
I think that, that symptom of drinking a glass of water and having to go to the bathroom like 10 minutes later is very frequently seen also with adrenal fatigue, right? So that's a whole nother topic. But if you're one of those people that can't drink water because you have to pee straight away, then think about adding a bit of salt and some potassium and some magnesium, like Anne said, and in the form of electrolytes. There are a few that we use, whether that's the mineral drops or different concentrated mineral drops. There's a number of them out there, and that often really helps a lot. So that's a really good tip.
Does.
And what's the usual milliliters of water per kilo or so? Is there like a standard of what you recommend?
Well, the average person, if you get between 2 and 2.5 liters of water per day, and that includes your teas. So if you're having herbal teas, and is going to be a nice, safe level. If you're having difficulties in balancing your electrolytes, and I do want to point out, electrolytes are sodium, potassium, magnesium is a huge player, and calcium. So you need all 4 of those minerals. But getting your fluid intake as well as balancing your magnesium is going to really help with energy. And I think magnesium is one of those minerals. We know we need it. We know it does so many things. But the average healthy person who is not stressed, doesn't have gastrointestinal issues, needs about 10 milligrams per kilogram of body weight.
I am. That's a good one.
And that's just, basic.
Yeah.
And if you're under stress, if you've got digestive issues, if you've started this whole game deficient in magnesium, it's good to work with your practitioner, get your levels checked. Find out, are you taking a good magnesium?
Some good clues that you might be magnesium deficient are things like cramping in your calves or cramping in your feet. So cramping is often seen with chronic magnesium deficiency. And when you are stressed, like Anne says, your magnesium need can go up about 10-fold. So some people really do need to dose a bit more. So that's also a good tip. So we've got, in terms of fatigue, just to summarize, we got the die-off that might be happening. It might be your metabolism not switching properly to a low carbohydrate diet. If that happens, what is your recommendation? I don't know if we did the recommendation.
Well, there's a few things. If you've gone all of a sudden to a lower carbohydrate diet and your body is trying really hard to utilize the chicken and the proteins that you're having along with the extra fats in your diet, you might want to look at using something known as exogenous ketones. There's lots of them on the market. You do need to read the labels. Some of them are better than others. So you want to go for one that's low in sugar, but they're water soluble. So many people will try to get that extra ketone energy level by having extra coconut oil or MCT oil.
Right.
And the water-based exogenous ketones might be better tolerated to help get that little lift that you're looking for.
And that's what people are going to see on the label, exogenous ketones?
That's what they're called. They're just powdered ketones.
There's no brand label that you recommend or so?
Depending
it's all right. We're not going to do the brand label. Just look for exogenous ketones. Very good. All right, good. So that's like when you've tried all else, and also talk to your practitioner about maybe you don't need to go ultra low carbohydrate. Not everyone, for example, people that are losing too much weight, we often maintain a certain amount of carbohydrates in their diet so that they don't lose more weight. So again, the summary is die off, metabolism, try what Anne suggested, or talk to your practitioner about keeping carbohydrates at a certain level, electrolyte and dehydration. I think that's a really, really important point, right? And then on the other level, sort of peripheral consideration are adrenal issues and other systemic issues. So I hope you found this really useful. If you are somebody who has a lot of digestive problems and you are working with a practitioner, you might also want to consider looking at the SIBO Success Plan. You can find that on thesibodoctor.com. And that is a self-guided informational course I've created for patients. And also, if you want to work with Anne, who does all sorts of amazing nutritional assessment here at the Biome Clinic, you can find her at thebiomeclinic.com, and you'll see the link up here, hopefully on the bottom of the screen. So thank you for your attention, and we wish you all the best on your healing journey.
Absolutely.
And we'll see you another time with another informational video.